clinical manifestations and differential diagnosis of the COVID-19. So today's war is a world versus virus war. Okay. Now, which is the common enemy of the all human being is coronavirus. So what is this coronavirus? It is a class of respiratory. It is a class of respiratory virus, includes common cold, SARS, MERS, and others, and duration from 0 to 5 days. And this RNA virus from the beta corona family. Now, history taking and is very, very important. For 14 days, travel history is very important, like epidemiology. And within 14 days, if the patient is having such symptoms, and if there is a history of travel, then you should able to find what is the problem. And if there is suspected contact, that physician and any general practitioner, history is very, very important for it. So the affected person 15 days back, suppose he has come from Dubai or Mumbai or any other place, then anybody having of this myalgia or symptoms of fever, it should be suspected, can this patient is having this. Symptoms in a small area or an office or a school, if 3 or 4 persons are getting affected, then you should be able to suspect that can this patient is having this coronavirus. Cluster in 2 weeks onset. Then what is the common fear in the mind of people? Not everyone who gets coronavirus dies, because the death rate of the coronavirus is only 2%, and most of the patients, they recover. Respiratory viruses have received particular attention, and there were 2 viruses. Most common was SARS and MERS, Middle East. And there were so many epidemics like H1N1, H5N1, we have experienced that. And what are the viral infections of the respiratory tract? Because respiratory tract, I call it is a gateway of India. Anybody goes from this, and another is India gate, that is mouth. So these viruses, they enter through our nose. These are influenza virus, rhinovirus, coronavirus. And in influenza virus, there are para-influenza viruses, and in coronaviruses, respiratory syncytial viruses and adenoviruses. So these are the from exposure, the recovery is 90%, and 10% of the patient, they go for acute respiratory distress syndrome, and they go in septicemia and a lot of pneumonia and these problems. So it is not new. We have experienced a lot of pandemics. In 1918, there was H1N1 Spanish flu in there were 20 to 40 million deaths. And these are the Asian flu, Hong Kong flu, reemergence, and again corona in 2003 and 2009, there was a swine flu. So these are the symptoms. So anybody getting, first of all, most is virus seem to start with the fever, followed by a dry cough, and then after a week leads to shortness of breath, and some patient needing to hospital treatment. What are the common symptoms at the onset of illness? Currently, there have been reports of taste and smell disorders. Now patient is asymptomatic. He is having no fever, no headache, but they complain that I am getting some smell and some taste problem. So these are the cases in the United States. So we have to differentiate corona from other allergic diseases. There are so many allergies like food allergies, pollen allergies, and dust allergies or atmospheric allergies. So coronavirus, we have to differentiate from the cold or the common flu. In coronavirus, most of the patients, they start with a fever, dry cough, noticeable shortness of breath. Symptoms appear 2 to 14 days after the exposure. And in flu, what happens? There is a high fever over 100. Extreme exhaustion. Patient feel that I am very much fatigued and tired. Severe muscle or body ache, dry cough, chills, snuffy nose, headache, and possibility of vomiting or diarrhea. But in common cold, which we are getting day-to-day practice, there is a sore or a scratchy throat. Patient feel that there is something scratchy in the throat, cough, running of nose, stuffy nose, and mild fever if any. Fever is less, it is common cold. Fever is high grade, it is a flu. And fever with dry cough and symptoms of breathlessness, it is coronavirus. So what is the average duration of symptoms? Usually from 1 to 5 days. So symptoms may appear 2 to 14 days after the exposure to the include like fever, cough, tiredness, and shortness of breath. And these are the main 3 symptoms of the fever, cough, and breathlessness. So anybody having respiratory rate more than 28 or more than 30, we should suspect that he can have this coronavirus. So in day 1, patient experience fever and possibly also fatigue, muscle pain, and dry cough. A few may have had diarrhea or nausea. And day 5, patients who are older or have pre-existing conditions have difficulty in breathing. Patient with breathing difficulties admit to the hospital, and if you take the X-ray or if you do CT scan, then on 8 days, severe cases develop signs of acute respiratory distress syndrome, where lungs can't provide vital organs with the oxygen. Then patient with a worsening healthy breathing problems, intensive care, and they are put on the ventilators. And day 12, fever usually ends, but cough may linger, and in survivors, difficulty in breathing ceases after about 13 days, while the average death is around 18 to 19 days. So not everyone who has coronavirus gets symptoms. There are asymptomatic symptoms also, and these are dangerous. So in COVID, what happens? Fever, if any fever is more, then you should suspect this patient is of coronavirus. And these are the 3 categories, like sneezing or coughing is allergy. When do symptoms of COVID appear? After 2 to 14 days. And these are the common symptoms, less common symptoms, and severe symptoms like pneumonia or kidney failure and death. And these are the various differential diagnoses like COVID-19, cold, flu, and hay fever, in which headache is common in flu, and it is sometimes in hay fever. And sneezing is also common in hay fever because of some allergens, and diarrhea is not there in hay fever. So these are the most common symptoms of COVID-19, like dry cough and fever, which is there in influenza also. But stuffy nose, sore throat, they are common to cold, and headache, body ache, they are common to influenza, and sneezing in common to cold, and exhaustion in common to influenza. So these are the differential chart. We have to consider whether this patient is having fever, shortness of breath, or diarrhea or itching. So typical symptoms of the COVID is most common. These are the symptoms, and how to differentiate from the swine flu. In swine flu, you get lethargy, lack of appetite, nausea, vomiting, diarrhea, and swine flu is because of these peaks. And if we have difficulty in breathing, it is a serious matter, and we should go to the doctors, get your X-rays done. And most of the time, fever is in 88%, fatigue 38%, and muscle pain 15%. So coronavirus symptoms, most common, 98% of the patient, they get fever, dry cough, fatigue, sputum 33%, and some patient they get hemoptysis also. And these are the various. And what are the facts in Wuhan, China? How they are diagnosed? There were repeated cases of pneumonia from some particular area from the fish market in Wuhan, and they were having lymphopenia, they were having consultation or pneumonia, and they have found that this male predominance was more, and the patient was more than 50 years of age. Some patients had diabetes, hypertension, cardiovascular disease, and more severe cases were affected by the patients who were having diabetes. Hypertension 15%, cardiovascular disorder 15%. And what was the Italian experience? In Italy, more than 25,000 of the patients, they have died because of this. And what they have noticed, that 99% of the Italian virus victims had previous health conditions, like which are mentioned, diabetes, hypertension, and coronary heart disease, because they were taking some drugs. People of all the allergies or all the ages, they can affect it. And how to differentiate diagnosis? Most common is common cold. Most of the patients, they come fearing that can they have, and these are the various types of flu, like influenza A, influenza B, seasonal flu, influenza C, influenza D, flu pandemic, H1N1, and H5N1 is called as bird flu. And these are the various respiratory viruses. And the common cold syndrome, which is sneezing, running of nose, congestion, sore throat. And there are numerous viruses which are there. Most common is rhinovirus. RNA virus, coronavirus is also RNA virus. And we have to differentiate, the physician can differentiate. A cold is a common infection of upper respiratory tract infection, can be caused by more than 200 different viruses. The common cold is one of the most common illnesses to be differentiated from the corona. Otherwise, there is just fear psychosis, and patient may land into psychological disturbances. So the common cold, nasal congestion, and there was a flu called as 1918 and 19, and these are the various deaths which have occurred. 20 to 40 million patients, they have died. This is a similar virus, just like coronavirus, called as influenza, viral rhinitis, and these are the various symptoms. I'll not repeat. And these are the, what is the difference between this influenza and COVID is, in COVID, you get fever, cough, breathing difficulties, fatigue, shortness of breath. And in severe cases, symptoms become more advanced and severe acute respiratory distress syndrome, kidney failure, pneumonia, and death. But in influenza, fever, headache, cough, sore throat, chills, and muscle ache. So X-ray is the most important diagnostic in pneumonia. These are the CT scan finding where you can get this bilateral shadows here, like picture of this. So most, even if your blood test is, it will take some time, but you take the X-rays or this CT scan, you can diagnose this patient is having this patch of pneumonitis. And these are the pathological specimens. What is the advice to the public? No regular, this important is wearing rubber gloves. In my hospital, there are staff nurses, they are just wearing the rubber gloves and they are touching here and there, but it is a false security. Is wearing rubber gloves while out in public effective in preventing the new coronavirus infection? It is not, because most of they are touching their nose, they are touching everywhere. So regularly washing your bare hands offer more protection against catching the COVID-19 than wearing the rubber gloves. So you can still pick up COVID-19 contamination on rubber gloves. And if you then touch your face, the contamination goes from your gloves to your face and can infect you. So with this, thank you very much for listening to me. Thank you so much. Over to Sonika. Thank you.